welcome to Mild and Tad YouTube channel, and I have posted another skills video. Check it out and let me know if you guys have any question. Be safe. Hi, my name is Mahalet, and today I will be showing you how to do NG tube insertion. So NG tube stands for a nasogastric tube. It is an additional, if the patient needs additional nutrition, the tube goes through your nose all the way to the stomach and help get more nutrition for the patient. So for the items, the equipment I need are, I have my tape, my pen light, my syringe, my lubricant gel, my gloves, pH strip, my safety pin. I have my patient. I have a basin, and also a water with a straw for my patient to sip in. And then I have my towel, and my stethoscope. So these are the items that we need in order to do this procedure, and also make sure the tube, make sure that it's they have like the suction tube, the canister, and everything is ready, and also check if it's working, if prescribed like anything for the patient. So the first thing I would do is I will go ahead and introduce myself. Hi, my name is Mahalet, and I'm gonna be your nurse today. Is that okay? Yes. And then after that, I will tell the patients the procedure. I'll tell them about the NG tube that can help them for additional nutrition. And the tube goes through the nose all the way to the stomach, and that will help you getting additional nutrition, and tell them it's prescribed by their doctor. And also, after I get the consent, I'll ask my patient if they have any questions, and I'll tell them I might feel uncomfortable through the procedure, and if they have any questions or anything, or if you want to sip a water, they can raise their hand and ask for that. And after that, I'm gonna perform hand hygiene and go ahead and wear my gloves. Test this out, and I have to we need to raise the head of the bed in a high follower position, or if a patient tolerated, so we have to make sure the patient is up on his upper body. I make sure I provide my privacy, and go ahead and start with my tube. So this is the tube I have. I'm just gonna take this out and take my adapter and connect this. After I connect this, so what I'm gonna do is I'm gonna ask the patient to lean back. After this, like, this tube, I'm gonna go ahead and place it into my warm basin water. And after that, I'm gonna go ahead and assess the patient. So while I'm assessing the patient, I'm gonna ask them to lean back, and then check for the nostril, for any if there is any intachtness or irritation or any abrasions. I'm gonna go ahead and check for if there is any obstruction or deformities. So I have my patient lean upward. Check. Okay, I don't see anything, no abrasion or any skin, any deformities. And after that, I'm gonna have my patient hold one nose and to take air out to see the patency that's coming out. And I'm gonna do that for both nostrils. I'm gonna have it hold one and sniff, and then I'm gonna have them do the other one and then breathe out. And after that, I'm gonna take that had the greatest airflow, whichever has the greatest airflow. I'm gonna go ahead and use that nose. So I'm gonna be using this side. So I'm gonna go ahead and get my tube, and first thing I need to do is I'm gonna go ahead and measure it. So when I measure, I'm gonna start from the tip of the nose, the tip of the nose to the ear lobe, and then from the ear lobe all the way to the stomach. And let's say I measure it, and then after I measure it, okay, so let's say it came down to 55. So I'm gonna go ahead and mark 55. I'm gonna put a tape for now. Right after, so I put the tape, but this tube has marking, so you can always, if it has a marking, you don't have to use the tape, but I just did. So you can check get the number so that you can remember. I'm gonna put it back in my basin. Gonna give my patients their water. It's not convenient, so I'm gonna give it to them, but I'm gonna move it so that I have more room. But make sure you leave it with the patients. So every time you wanted to drink and have water, just raise your hand and you can have a sip of water. If you feel uncomfortable, just raise your hand. We're gonna stop and have you get rest. You explain that to the patient just to make them comfortable. And I'm gonna go ahead and place a towel under my patient. So after I place my towel, I'm gonna go ahead and bring my tube. And what I'm gonna do now is I'm gonna go ahead and lubricate the tube. I can just either insert it or just put it on anywhere, and then you can just lubricate the tube. After I lubricate the tube, so I'm gonna have the patient curve toward into the whichever nostril I'm using. So I'm gonna ask my patient to hyperextend their neck, and gently I'm gonna go ahead and advance the tube toward the nasopharynx. I'm gonna go ahead and do it. So every time you do it, you just make sure your patient is comfortable. The procedure is uncomfortable, but try to make them as comfortable as you can. And then after that, I'm gonna start directing the tube along the floor of the nostril and toward on the inside. Okay. So if they need a water, you give them a water. They have a sip. So if while you're inserting the tube, if you feel any resistance, we have to withdraw and then lubricate it again and then insert it. So we'll have a good. It's a little bit hard to do it on the mannequin, but so we make sure we insert it to the thing, to the measurement we did. That's because that's what we measured, so it goes to the stomach. So make sure you do it until the marks. So and if any resistance met, withdrawal, lubricate it again, and then insert it. And once the tube reached the orpharynx, the patient filled tube in the throat may have a gag or reflex, like have gagged or retouched. So at that time, you have to ask the patient to tilt a head forward, and you encourage the patient to sip and swallow water just to calm down the gag reflex. And after you pass tube like 5 to centimeter, I believe 2 to 4 inch, and swallow, and until the indicator, like any so as I said earlier, until indicated the lens was inserted. So we are supposed to be go all the way till here. So make sure you do it that way, just to make sure it reached the place that we want it to reach. And then after that, we're gonna go and gonna go ahead and check for the correct placement of the tube, and you just always make sure you're following the facility policy. And then after that, I'm gonna go ahead and what I'm gonna go ahead and do is that aspirate the stomach content to check for any to check for the pH. So I'm gonna go ahead and you can leave this one here. Forgot to put the adapter here. So I'm gonna go ahead and aspirate the stomach content to check a pH. You just have to aspirate, not a lot, just a drop. Okay, after I spray, make sure you hold it around here. Oh, before we do that, I forgot, my bad. So before we do that, after we insert this one, we have to tape it. So make sure you tape it, because if we're not taping it, and then if I start doing all that, this is gonna come out and it's gonna hurt the patient, and then you have to do the procedure all over again. So good thing I remember. So you always have to make sure you tape this before you go anywhere else. So make sure you tape it, and then after I tape it, that's when I'm gonna go and go and check for the pH. So just a drop, hold it here. So because we don't want anything to come out, so make sure like to kind of hold it here and check the pH. We're expecting to have a pH 1 to 5. Okay, good. Then we're gonna put this back, and then now I'm gonna go ahead and list after I go and check the stomach content, the pH, what I'm gonna do is that I'm gonna go ahead and place my stethoscope over my patient's epigastrium, and this is like there's two ways to confirm the right placement. One is done by X-ray, and then this is the other one is what you do is like you inject 5 to 20 milliliter air while listening to like for any whooshing sound. So I'm gonna go ahead and place this on my patient. So at the same time, while I'm listening, I'm gonna go ahead and inject the air. If any signs indicate it, it means the placement is wrong. So we have to remove the tube and do it again. And if you hear any signs. So once we do that, I'm gonna go ahead and take this out. The placement is good. I checked, there's nothing abnormal, and I checked. I'm gonna take this out and put this in. So after I put this one, once I confirm that it's the right it's on the right place, everything is good, I can go ahead and see if I can attach this to the suction source, or for any fitting apparatus, or add anything. If it's prescribed to be sectioned, I'll attach it to the section. I'm going to attach the suction here. If it's supposed to have a fitting, I'm gonna attach the fitting here. And after that, I'm just gonna get my safety pin and attach this to the patient's gown. Let's say I pretend like this is a gown. So I'm gonna go ahead and attach it to the patient's gown. Make sure you don't kink or anything to the tube. So I'll attach it to the patient, and also make sure you give them enough room before you attach it to the gown, because when they move, they will have more room to move as they wish. And after that, I'll make sure if my patient is comfortable. Always make sure to keep the head of the bed lifted about like 30 degrees. I'll ask if my patient wants some water, or if they're comfortable, do they need anything else. I'll make sure that I leave them very comfortable and cold light within reach. And after that, I'm gonna take off my gloves, trash it, wash my hands. I'm not sure if I said it before, but always have to make sure to provide privacy when you do your procedure. So if I didn't say it, I apologize.